My name is Nurse Brown, and the doctor has ordered for respiratory assessments and also cardiovascular assessments on you. Can you start by stating your name and date of birth for me?
Samaya Cochran, birthday 02/02/01.
All right, let me check your wristband. And have you been having any chest pain or shortness of breath today?
No.
You haven't? All right. Well, there are two techniques that can be used to help the respiratory system. One being you'll take a deep breath in, you'll turn your head and cold. And what this does, it helps loosen up mucus and it can help prevent pneumonia. Can you demonstrate that for me? So you'll take a deep breath in, you'll turn and cold. All right. Now the next technique used, well, it's a medical device and it is called the incentive spirometer. Now you'll use this 10 times an hour and you can use it while you're awake. Or you can use it during this time you're watching TV and a commercial come on. You can just take an inhalation through the tube and you'll measure the number as it's going up. And you'll try to beat that goal each day daily. And this can help exercise the lungs and it can improve the lungs as well. Alrighty, you can demonstrate that one time, just inhaling it. Alright. And now I'm going to check your respiration rate. Just hold your hand. Alrighty, your respiration rate was 16 breaths per minute. Now I would like to listen to your lungs. The first part, we're going to start in the right upper lobe of the lung, and we're going to listen to it. Take a deep breath in and exhale out. Then we're going to move to the left upper lobe of the heart, or the lung. You take a deep breath in and exhale out. And now I'm going to listen to the lower upper part of the left lung. You're going to take a deep breath in and exhale out. And now I'm going to listen to the right middle lobe of the lung. You're going to take a deep breath in and exhale out. Alright, you just lift up for me. And now I'm going to listen to the left lower lobe. Take a deep breath in and exhale out. And now I'm going to listen to the right lower lobe of the lung. You're going to take a deep breath in and exhale out. Alright. Now I will be listening to the posterior side. I'm going to listen to the right upper lobe. Take a deep breath in and exhale out. Alrighty, now I'm going to listen to the left upper lobe of the lung. Take a deep breath in and exhale out. Now I'm going to be listening to the left lower lobe of the lung. Take a deep breath in and exhale out. And now we'll be listening to the right lower lobe of the lung. Take a deep breath in and exhale out. Alright. No adventitious sounds in the lungs. Now I will be doing a cardiovascular assessment. Now the first thing I like to do is check for any JVD in the jugular vein. You can just tilt your head back to the 45-degree angle and turn away from me. Now just check on that side. And then I'll ask her to tilt again to 45 degree and check on the other side. And there's no JVD found. And now I will check the carotid pulse on both sides. And now I'll check the axillary artery on both sides. Now we'll check the brachial artery on both sides. Alright. And now I will check the posterior, the popliteal artery on both sides. And her arteries so far are showing a +2, meaning normal pulse. And now I will check the dorsalis pedis pulse on both sides. And I will also be checking for the posterior tibial pulse on both sides. Bilaterally, all the arteries are checked. All right. Now, I will check for edema in the left extremity, left lower extremity. I will just check if there's any swelling in the left. Now I will be checking the right lower extremity for any edema. I'll also be checking the left upper extremity for any edema and the right upper extremity for any edema. And also you will check for capillary refills in the nails to make sure that there are good blood flow. All right. And I will check your heart. Now what you want to do is while you're checking heart, you'll come on the right side and you'll find the collarbone and you'll move 2 spaces down, and that should be the aortic area, the second intercostal space. So, and then you'll move over to the left side of the second intercostal space, and that should be the pulmonic area. And then you'll move down 1 space to the Erb's point, to the third intercostal. All right, and then you'll move in to the tricuspid valve, the 4th intercostal space. And could you lift up for me? And then we'll move to the apical pulse of the 5th intercostal space, and we'll check for a full minute. Alrighty, her apical pulse was 83 beats per minute. Alrighty, now I would like to go over the more scale with you. Now, in the past 3 months, have you had any types of falls? You haven't? Now, have you been diagnosed with anything that I might need to be aware of? No, you haven't? Okay, and when you're moving around, do you need any type of assistance like a cane or crutch, or do you need like a bed or furniture that you may need to prop against on when you're walking, or you need nothing at all? Okay, and when you walk or in your daily living, do you ever feel weak, or do you feel impaired to like where you're not able to move at all, or you don't feel neither?
I don't feel neither.
Okay, alrighty. Now the last thing I would like to do is go over safety with you in their stay with us. Safety is an important thing for patients, and such things like having on grip socks so that can lessen the risk of falls, and also having your call light with you near you to in any case of emergency, and also being able to go to the bathroom or anything and have visible light so that you're able to see is an important thing for you. And also having the bed lowered to the lowest position so you're able to get out easily like you should. And also another thing is us as nurses and other workers, we need to be on hourly roundings